Today on Town Hall.
In my opinion, and it can be unpopular, there has to be regulation.
Yeah.
But it has to be at the right level too, so that we don't inhibit the benefits that we could gain from it.
Right.
My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Town Hall show is designed to bring insights from practitioners and leaders on the front lines of healthcare. All right, let's jump right into today's episode.
Hello, I'm Sue Schade, principal at StarBridge Advisors and one of the hosts for the Town Hall show at This Week Health. Today, my guest is Brian Sterud, VP Information Technology, CIO, and CISO at Faith Regional Health Services in Nebraska. Brian has been in this role for 13 years. I'm looking forward to catching up with Brian today to hear what he and his team and Faith Regional have been focusing on. So welcome, Brian.
Yeah, thanks. It's a pleasure to be here.
This should be fun. Let's start by having you briefly introduce yourself and tell us about Faith Regional.
I've been in this role for 13 years at Faith Regional. We're located in Northeast Nebraska. We cover a pretty wide geography as it relates to this part of the country and being very rural. So I have a multi-specialty physician practice as well with about 100 providers in addition to the hospital, and have responsibility for all of the above. And some of the challenges we'll talk about that go along with it, we'll talk about in the next couple of questions. But really great organization. We do a lot of things that aren't done in cities our size. We have a heart program, a cancer program. So really proud of what we're able to do.
Great. Well, let's talk about some of the challenges being a rural health system. Let's just start there and share what some of the things are that you face as a rural health system that maybe a big city health system or a big regional health system doesn't face.
Yeah, a lot of it comes down to, there's a couple different things. And I think maybe we'll talk about workforce a little bit later. But as it relates to the rural nature of how we're dispersed, there's a lot of things that we do to accommodate for that. We have patients that could drive up to 2.5, maybe 3 hours to see us. And so to the extent that we can leverage telehealth, that's very important to us. That's something that we've been doing for a long time, and that can help in those scenarios. We also have some other ways that we accommodate those things. So we do, and I forget the number, it's a crazy number of outreach clinics that we do. So our cardiology program alone, I shouldn't even say the number. It's dozens of sites that they go to. So in those circumstances, they go out to a community, they're able to partner with a local hospital in many cases and do an outreach clinic. And we have, like I said, dozens and dozens of those in order to help serve our patients. So those are some of the challenges. There's obviously, our team is covering a lot of ground when there are IT issues at some of those places. There's about 10 locations outside of Norfolk where we have permanent clinics.
So do you have your IT support staff who are in Norfolk there and go out to these other locations that are at some distance? Or do you have staff based there?
Everybody's based here, and we send folks out when they need to be. Some of it pre-scheduled. We have an affiliate hospital that we provided IT services for the last 4 or 5 years. There's no ownership. It's just an IT agreement. And that is on certain intervals. We will proactively go there. The rest of the locations are as needed. Outside of, we proactively round on them. And that's this really pretty simple block and tackle stuff. But I mean, it has dramatically reduced the number of tickets that come in as emergencies. They feel more connected with the organization because some of these clinics are quite a ways away from us. And so I think that's really been beneficial.
So proactively rounding can be beneficial regardless of location. So that's good to hear that makes a difference for you. So tell me about some of the current priorities that you and your team are working on.
And maybe completing is the wrong word, but we're getting closer to finalizing an IT plan. Obviously, that involves all kinds of things. One of the most prominent being artificial intelligence type of initiatives. So we had a very specific session about artificial intelligence and innovation. And so I kind of lump those all together just because some people see different automation processes. They'll lump that in with artificial intelligence. It really isn't. But one way or another, if there's innovation that needs to happen, that's all on a list that we're working through to prioritize. And I think what I've really tried my best to do is I would like to understand and entertain the problems that we have and then find ways to solve them. I think lots of people right now are running around with a solution looking for a problem. And especially in artificial intelligence, things are kind of really happening fast. So our goals are to look at what our business problems are and then allow us some opportunity to find a way to solve those problems.
Great. That seems like a sound approach. Are there any particular projects in that area that you want to highlight?
We're doing things like just like almost anybody else, like with ambient listening and those sorts of things. Those are certainly becoming very quickly table stakes, I think, for everybody. And then as it relates to some budgetary expense cutting and that sort of thing, I'm involved in a lot of conversations about where there may need to be an opportunity across the entire organization and where we may be able to help use technology to help solve that problem and help reduce expenses, whether it's labor or whether it's other sorts of things. So working through all that right now.
Okay, great, great. So you have both the CIO and the CISO role, which maybe is more common for a smaller health system like yours, but how do you handle holding both of those roles?
Yeah, I think the first thing is that I have a director that works for me. Her name is Emily Crone, and she's fantastic. Without somebody as strong as her, that would be challenging and would require more intervention on my part. So that's the first reason I say I can do it, because she's great.
So she's kind of like a deputy or dealing with operational stuff for you?
Yeah, I mean, if we think about what happens on a day-to-day operational IT, so she's not called a deputy. She surfaces things to me that require my attention, but otherwise she's handling a lot of day-to-day operations that way. So it would be very similar to that type of role in a large organization.
Okay.
And then because of that, I can try to split my time. The percentage of time that I spend thinking about cybersecurity is obviously a lot more than it was 10 years ago.
Yeah.
I think that's common for everybody.
Yeah.
But I try to then fulfill that role and pay attention to where we have risk. I work closely with our risk manager, and then strategically utilizing consulting firms that can help us. I'd be remiss if I didn't mention that, because in order to wear two hats like this, there has to be some reliance in that sense as well.
So we had a chance to talk early May, and I heard some about your workforce challenges and the fact that you have a college partnership program that you've developed, workforce challenges specific to location, a rural setting. So tell us about that and what those challenges are and how you're addressing them.
Yeah, we're really excited about it, really proud of that partnership. And so just to start, in a rural area, recruiting talent is extremely hard. I think it's hard for actually in an urban area right now too.
Yeah.
So it can be very difficult. For us, a lot of times it is either discovering somebody that grew up in the area, moved away, now they have kids and they want to be back home. Those are fantastic. We love those. And then aside from that, it's the ability to then internally develop our talent that we have. So we've done a couple different things with that. We have our field support positions that we have created a kind of a junior system analyst or a bridge between that role and the next opportunity. And I think that's going to help us out and to try to bring up the folks that come into our entry level positions and grow into larger roles. That's something that's been a change for us, and that hopefully produces good results. And then as it relates to the partnership, it's with Wayne State College. And so there was a group that came together to look at workforce issues in Northeast Nebraska. It involved our state senator. At the time, he wasn't, he is now. And just looking at what can we do to build workforce, and it's actually across it's not just IT, but a really visionary group that said, tell us what you want. And so myself and some other IT leaders in the region sat down and had some meetings. And to be honest, these are meetings that people have lots of times, but I would say that actions aren't always swift or happen at all. This thing came together and there was so much priority placed on it. Pretty much everything that we recommended needs to happen was done and built into the program. And the program was started very quickly in relative terms and how those things can be turned around. So where we are, part of what that program does, then it takes the students through the curriculum in 3 years. And then in the 4th year, they're working, quote unquote, full time. I think it's like 30 hours as an internship, and they're placed at local businesses. So Wayne, Nebraska is about 30 miles away from us. It's a smaller town, but they actually then built an apartment complex in Norfolk, where I'm at. And in that 4th year, you live in this apartment complex. and you work for one of these companies. So it takes a while, as you might imagine. And so they only enroll as a freshman. So that takes those 4 years to get first class. The first class was a year ago. Had a great intern there and had a great experience. And we've hired graduates now, which is the idea, right? I mean, the idea is that you can get them exposed to our organizations, to the community, obviously hire them, and at least create relationships with people that could benefit downstream later too. So really been excited about it. We've been very involved in it. We have internship opportunities outside of IT as well. So we've had HR, marketing, finance. So that's been a really great relationship with the school.
Excellent. Well, we all know that pipeline's critical, and we have to really look ahead and be patient, right? They've got to get through their training program first or school before they can intern for you. So do you have interns already that have been through that program, or is it too new?
Yeah, they've been through the program, and we've hired as a full-time employee, one that just completed it.
Great.
And we've got folks slated to come in next year. We have a little bit of gap in the summer as far as coverage, obviously, but
Sure.
yeah.
Great. And do you require people to be on site, live in the area, or are you able to hire people from other states to work remotely?
It can be a challenge. We're typically hybrid, so we allow so many days per month where they can do remote. Some of the payroll laws that can get kind of difficult depending on states can be tough to deal with. So we allow at certain levels remote within the state of Nebraska. So that helps us a little bit. Outside of that, you have to get a little bit more creative, but typically we're state of Nebraska, fully remote. We do actually restrict that even within the state, only if you're at a certain level of position within our IT organization, just because we want to build that culture and we want to have the connectivity. Once you're at a particular level, then there's more opportunity that way.
I'm going to pivot. Let's talk about regulatory challenges. I know you're on the CHIME Policy Steering Committee. What are some of the regulatory challenges that you are all looking at right now, and how are you handling them at Faith Regional?
Yeah, so I'm very thankful to be on the committee and to serve on that committee. It allows me to be way more informed than I would be if I was not on it. So I think that's something people maybe don't think about. I learn and hear of things fairly early on, and that allows me to, maybe there may not be actions that are taken at that point, but at least it's on your mind. You think about what could happen.
So that's a pitch for being on the committee and being involved.
Yeah, great. Yep. Get involved, be on the committee, know what's going on. I'll be the first person to tell you that I don't like reading contracts and I don't like reading regulations. They make me fall asleep.
Totally, Brian.
Yeah. They make me fall asleep.
Yeah.
However, that has to be a muscle that you exercise, so to speak. And I'll also say being on that committee allows me to kind of exercise that skill that I'm weak at and become way better at it and know what to look for. So what are we looking at? What changes? So obviously there's lots of things. Right now I'm watching a lot of things that aren't IT related. What's going to happen with reimbursements? What's going to happen with state directed payments? We're very interested in that one because the state of Nebraska is kind of in the middle of that conversation. Yeah. And so those things can change our reimbursements and therefore our revenue very dramatically. And depending on which way they go, can change things for us very quickly. Also interested to understand where AI is going to end up. I think there was a previous administration had begun some conversations about how that would be regulated. That's been rescinded and so it remains to be seen where that will go.
I think that's, my opinion, very concerning that regulation on AI would be pulled back.
Yes. The problem that needs to be solved that relates to AI and healthcare and regulatory is we need to not stifle innovation.
Right.
But we need to not have dangerous things occur either. In my opinion, it can be unpopular. There has to be regulation.
Yeah.
But it has to be at the right level too, so that we don't inhibit the benefits that we could gain from it.
Right. Agree with you. So I know we're running up on time here. Is there anything else that you want to highlight before we close that we haven't gotten to?
That's a really great question. The one soapbox that I didn't get on that I know
Here's your chance.
That I know folks would have expected me to say was when we talk about I'm super pro education. So going back to that program that we built,
right.
I find that and I don't think a whole lot of people disagree with this, but education plus experience is so important in IT. And so that's why we were so adamant about the way we wanted that program structured because we were seeing too many kids, I suppose I can call them kids, that were walking out of college with no experience and a degree that somebody told them was going to make them X amount of dollars. And in IT and probably lots of other places, but IT for sure, you're not prepared to actually really do a lot of things with just a degree. I'm also super pro education. It's just that you have to have both. So you got to get that experience and then get the degree to reinforce the things that you're learning. I don't believe in having one or the other. It has to be both. And so that's kind of how that program came to be.
Got it. Got it. Great. Well, that's a great note to end on in terms of our workforce development going forward. So thank you so much for taking time today. I think this has been very enlightening and look forward to talking to you soon.
I appreciate it. Thank you very much, Sue.
Thanks for listening to this week's Town Hall. A big thanks to our hosts and content creators. We really couldn't do it without them. We hope that you're going to share this podcast with a peer or a friend. It's a great chance to discuss and even establish a mentoring relationship along the way. One way you can support the show is to subscribe and leave us a rating. That would be really appreciated. Thanks for listening. That's all for now.